Okay, so first I would verify the patient chart with the medication administration record. I would make sure that I'm giving it to the right patient, Jaguar Jones. I would make sure I was giving the right medication, heparin, the right dose, 5,000 units, the right route, subcutaneously, and the right time, every 12 hours. I would also compare the charts for allergies, and both charts say penicillin. I would then perform hand hygiene and select my medication. So I would compare my vial with the MAR to make sure I was given the right medicine, heparin, and then I would check the expiration date, and it's not expired, and then I would calculate my dosage. So I'm supposed to give 5,000 units, which is 0.5 milliliters. And then I would select the correct syringe and needle. And so for this injection, I would use a 1 milliliter tuberculosis syringe with a 25 gauge needle. And if I needed to check my medication with another nurse, I would check my medication with another nurse. So now I'm going to clean my vial and open my syringe. Now I draw back 0.5 milliliters of air, remove the cap, and inject the 5 milliliters of air into the vial. And now I'll draw out my medicine. I would then recap my needle using the scoop method. And then I would check my 5 rights again. So I make sure that I was giving it to the right patient, Jaguar Jones, the right medication, heparin, the right dose, 5,000 units, which is 0.5 milliliters, and the right route subcutaneously in the right time every 12 hours. And then I would place a label onto my syringe. And the label would state the patient's name, the medication, and the dosage. So Jaguar Jones, heparin, and 0.5 milliliters. And now I would take my MAR and the medication and go to the patient's room. I would perform hand hygiene and verify that I have the correct patient by checking his 2 patient identifiers on his wristband. So I would compare it to the MAR, his name, Jaguar Jones, and the MR number, 417-6352. 417-6352. I would check for any allergies, and I see that he's allergic to penicillin, and it matches the chart. And so then I would again make sure that I'm giving the correct medication to the correct patient. So Jaguar Jones, and the correct medication is heparin at 0.5 milliliters. I'm giving it at the right route subcutaneously and at the right time every 12 hours. Then I would put my gloves on. And my goggles. And I would raise the bed to a comfortable working height and position my patient. And then I would explain the procedure to Mr. Jones. So I will be administering your heparin subcutaneously in your abdomen, and I will not go above the costal margin or below the pubic area. And I will not go outside of the anterior or superior iliac spine. So then I will again check the patient name, Jaguar Jones, the medication, heparin, the dose, 0.5 milliliters, the route subcutaneous, and the time every 12 hours. I would then uncap the syringe. Before I uncap the syringe, I would clean the injection site. in a circular motion. And then I would uncap the syringe. And then I would pinch the patient's skin and insert at a 90-degree angle. And I would discard my needle in the sharps container and remove my gloves, discard those, perform hand hygiene, move the patient back to the bed in a low position, raise the side rail, position the patient comfortably, and I would document what medicine I gave, which was heparin, the time I gave it, and the dose I gave it. And I would also document how the patient handled the medicine, and I would assess the patient. And then later I would come back and assess the patient again to see how they are handling the medication.